Hello, my name is Alexis Goldstein, and this is my presentation on varicella and its vaccine. The varicella-zoster virus causes the disease varicella, which is more commonly known as chickenpox. This virus is part of the herpes virus family, and chickenpox is one of the 5 classic childhood diseases. The most iconic symptom is an itchy, fluid-filled blister rash that begins on the face, chest, and back and then spreads over the entire body. This airborne disease is highly contagious and spread most commonly via close contact. Other symptoms include fever, cough, fatigue, loss of appetite, and headache. The varicella-zoster virus can cause a latent infection in neurons. This recurrent disease is called herpes zoster, or more commonly known as shingles. The vaccine for this pathogen is a live attenuated or weakened virus, specifically that of the Oka strain. The first dose should be administered between 12 and 15 months of age subcutaneously. A child should receive their second dose between the ages of 4 and 6 years. If a child has never been vaccinated or contracted chickenpox, the 2 doses must be given at least 28 days apart. This vaccine can be given at the same time as others, however, there has been an association between increased breakthroughs of chickenpox when simultaneously administered with MMR, or the measles, mumps, rubella vaccine. For this reason, it is recommended to issue the 2 vaccines at different injection sites or to administer them 4 weeks apart. The varicella vaccine produces both a humoral and cell-mediated immune response. The humoral response is activated by extracellular fluids, including secreted antibodies, complement proteins, or antimicrobial peptides. The vaccine provides a weakened antigen that induces the production of immunoglobulin G by binding to the antigen binding site. In contrast, cell-mediated immunity does not involve antibodies. Rather, this immunity is the activation of phagocytes, antigen-specific cytotoxic T lymphocytes, and the release of varicytokines in response to an antigen. For this particular disease, the varicella-zoster vaccine activates CD4 positive helper T cells and CD8 positive T lymphocyte cells, also called cytotoxic T cells. As with any vaccine injection, there is always a risk for pain, redness, bruising, or swelling at the injection site. After receiving the vaccine, it is possible to develop a mild rash. This typically occurs 1 month after the injection, and the rash is contagious. In this way, one can consider the vaccine to be transmissible. As for contraindications, those who had an allergic reaction or an anaphylactic reaction to neomycin or gelatin should not receive this vaccine. Both neomycin and gelatin are components of this vaccine. Further, pregnant women and immunocompromised individuals should also not receive this vaccine.